I'd love to get closing thoughts from each of you. And I'll start with you, Dr. Chang. What is the most important takeaway that you want to leave with those healthcare providers who are listening and watching this program?
Yeah, I think that the most important takeaways are actually two things, I think. One is really, really important to educate patients about their disease, about their treatment, about the potential side effects, and also to try to anticipate and mitigate those potential side effects so that patients know exactly what they're expecting. And then the second thing is really essential to have a great team around you because practicing medicine, particularly in oncology, is not a solo practice. We really need a village to take care of our patients. And so having well-trained nurses, having excellent clinical pharmacists, all of them are essential members of the team that will help with patient care.
Wonderful, Dr. Chang. Thank you. And Dr. Ermann, what are some closing thoughts you'd like to leave with our audience today?
I would say don't be afraid. In medicine, there's often this thought that reducing treatment doses or things like that is a bad thing and you shouldn't do it. I would say, I would empower providers to not be afraid to dose reduce, especially to mitigate very undesirable toxicities. So I'd say don't be afraid to dose reduce. There's a lot of, at least in some of our medications, good efficacy data showing that dose reductions can have similar, if not the same, kind of toxic or efficacy profile while mitigating toxicity. So I would say don't be afraid to dose reduce, especially if the toxicities are not improving. Don't be afraid to dose hold. And when it comes to empowering our patients more, I'm a big advocate on empowering patients, particularly diseases like CLL, where 2/3 of patients at diagnosis don't require treatment, and they're told that they have cancer, and then all of a sudden they're told that they don't need treatment, can be very scary. So I think that when patients feel like they have their disease understood and that they're doing the best that they can for their own disease, it makes it makes it better for everyone involved. I think empowering both providers and patients is kind of the optimal way to do things. And those are the best patients. When you deal with someone who knows their cancer, knows what's going on, sometimes I get patients, they know as much or more than me. And I'm like, wow, this is incredible. Those are the best.
Oh, that is such a perfect way to end this program. An empowered patient is the best patient.